Hi, let's talk about mistakes pregnant women should avoid. Pregnancy is a beautiful and exciting time for expectant mothers. For a pregnant woman to have a safe pregnancy and delivery, it's very essential to avoid common mistakes that women make during pregnancy. 1. Not getting enough folic acid. Folic acid is very important during pregnancy because it helps in the development of the neural tube in the fetus, that is the baby in the womb. So folic acid prevents neural tube defects such as anencephaly, spinal bifida and others. Foods such as leafy vegetables, nuts and citrus fruits are rich in folic acid. Folic acid is one of the prenatal vitamins that is given to pregnant women during antenatal clinic and is given to you by your midwife or your doctor. You have to only take the ones prescribed by your doctor. So if you don't want to deliver a baby with neural tube defects, don't make the mistake of not taking your folic acid because it's very important during pregnancy. The second mistake to avoid during pregnancy is not attending antenatal care. Not registering for your antenatal care or skipping antenatal is one of the mistakes to avoid during pregnancy. Surprisingly, some pregnant women might even stay up to 9 months without attending antenatal care, but will appear to the maternity ward for the first time only during labor, and it is not good. Regular antenatal care is essential during pregnancy for the health of the pregnant mother and that of the baby in the womb. So attend all scheduled appointments and keep your health care provider informed of any concern or if you notice any change in your health. The third mistake to avoid during pregnancy is over-exercising. Exercise is very good during pregnancy. Of course, a pregnant woman should remain active throughout pregnancy, but try to avoid strenuous exercises. Excessive exercise should be avoided. It's very important to listen to your body. And don't engage in any activity that can cause pain or discomfort. 4. Too much stress. Stress is not good for the health of the pregnant mom and that of the baby in the womb. So pregnant women should reduce stress, or better still, avoid it. Make out time to rest. It's important to manage stress. You may seek support from family members and friends. 5. Not getting enough sleep. Pregnancy can cause fatigue, so it's good to get adequate sleep no matter how busy you are. So ensure you get enough sleep to support the growth and development of your baby in the womb. The sixth mistake to avoid during pregnancy is by not knowing emergency signs in pregnancy. A pregnant woman should be able to identify emergency signs in pregnancy in order to call her midwife or her doctor immediately. Signs like if your water breaks, or you're having 3 or more contractions in less than 10 minutes, or period like something pouring out from your birth canal, or your baby is moving less than normal, and other signs which we've talked about before. 7. Not organizing yourself and your family before labor starts. There are important things to do before labor starts, like making arrangements on who will transport you to the hospital, how to pack in your hospital delivery bag, getting your baby things and items ready, making your hair, packing and arranging baby's clothes, stocking up your fridge or freezer with foods. These things are very important for a pregnant woman to do before labor starts, because once labor starts, there is no going back. 8. Not knowing the signs of labor. Every pregnant woman, especially first-time moms, should be able to identify the signs of labor. Signs of labor like presence of show, uterine contractions, backache, urge to go to the toilet, cramps, water breaks or may not break, and other signs of labor. We've covered a lot of topics on this page. 9. Not providing the hospital requirements for the delivery of your baby. A list of hospital requirements is usually handed over to pregnant women during antenatal care by the hospital where they will have their baby. And it's good to make those requirements available. You can buy the requirements once or little by little, but ensure you provide it because that's what your midwife or your doctor will use to deliver your baby for you. To avoid forgetting it, pack it earlier enough. Once you know you've approached 37 weeks, your baby can come anytime from that moment. Ensure you arrange your hospital requirements list in a separate bag. The last mistake I'm to talk about here for you to avoid during pregnancy is by not preparing for post-pregnancy. It's important to provide for post-pregnancy period, such as bonding with your baby, recovery after delivery, and coping with new motherhood challenges. I wish you a safe pregnancy and delivery. Bye.